Okay, I'd like to call this meeting of the Municipality of Anchorage Assembly Committee on Homelessness to order. It's Wednesday, February 19th at 11 o'clock a.m. Let's start by going around and doing introductions to people at the table. Would you like to begin, please?
Sure. Molly Milius, Agnew Beck Consulting.
Thea Agnew Benben with Agnew Beck.
Hi, Shanna Zuskran with Agnew Beck Consulting.
Dean Gates, City Council. Forrest Dunbar.
Austin Davidson. Thanks, Allentown.
Cameron for video.
Felix Rivera.
And then all on the phone.
Crystal Kennedy.
So on the phone, I know we have member Crystal Kennedy, Chris Constant, and then also is Suzanne LaFrance. Are you on the phone as well?
Yes, Mr. Chair. Suzanne LaFrance is here.
Thank you very much. Great. Well, welcome everyone. Thank you for being here today. We're gonna begin actually with we've been trying this out. We've been doing a small portion of audience participation to make sure if there are people that really need to make sure that they speak first. So we've got about 10 minutes for a few folks to come up and speak, and then we'll end that part and get into the business part of the agenda. So with that being said, there's a microphone right up here. We'll just sort of do it first come, first serve. Would anybody like to come up and share their thoughts with the committee? All right, none? Okay, seeing none, we'll move on. Let's get right into the business of the meeting. I think first we have Agnew Beck here, if you'd like to begin your presentation. And yeah, you can just use the mic for this right now. Thanks.
Good morning, everyone. This is Thea Agnew Benben. I'm with Agnew Beck, and we are here to present on a study that we completed, but we're not completely complete, but we will be completing shortly, and have been working on since last summer. And it's related to the parcels that are owned by Mr. Radoliva that are adjacent to the Brother Francis Shelter and Beans Cafe down on 3rd Avenue. So we'll be giving you our draft findings on this project, which was really to develop a vision and a concept level land use plan for that area. And we're going to be sharing the presentation, so you'll be hearing from all of us.
This slide here orients you to the space. There are 3 lots covering about 4 acres. You can see the corner of 3rd and Ingra. The access is off of Ingra. And again, adjacent to Brother Francis Shelter and just down the hill from the former A&MC site, which has recently also undergone a visioning session or process for those properties. Here's another photo of the space to help everyone get oriented. And so just a little bit of background about the property itself. It does have somewhat high ground failure susceptibility on the scale of 1 to 5 for ground failure. In Anchorage, it is rated zones 4 and 5. That doesn't mean development is impossible, but it does limit it somewhat, and development may be a little bit more expensive there. It does have relatively steep slopes, especially along 3rd Avenue. The access to it is a little bit challenging on that side. In current both community plans and Anchorage zoning, it is identified as industrial or categorized as industrial land. There is some environmental contamination that we know about on the properties. We don't have a lot of detail, but we do know of some contamination there. And then, as I mentioned, it's adjacent to that A&MC site that was recently planned for.
Okay, so this is our study goal. Really, our job was to do as much engagement as we could with the various stakeholders for these properties and in this area, and then to use that as well as case study research from other communities to try and come up with a vision and kind of a proposed set of uses and some phasing of those uses for the site. And I should have mentioned at the beginning that this project was funded by the Alaska Mental Health Trust Authority and also by the Rasmussen Foundation. And we've been, Robin Ward's been our contract manager here at the meeting. Oh, and the small amount from the beginning. Sorry, don't want to forget that. So we started the project really understanding that the status quo in this area is not working for anybody. There's nobody that's happy with the state of affairs that currently exists down in this area. So the property owners, residents, business owners, the service providers that are trying to serve people in the area, that's Catholic Social Services that runs the Brother Francis Shelter and Beans Cafe. And then the people who are experiencing homelessness who are trying to receive services in that area are also not being well served. It's not a very safe place to be. It's pretty chaotic. It's not providing the functions that are needed for the people who are experiencing homelessness. And then, of course, for emergency responders, the assembly policymakers, it's a difficult situation. There isn't a clear or easy path here. So that was where we started the project. Really, the timeline, we started kind of at the end of the summer, and we really did the community engagement on this in a pretty iterative way. So we started off with kind of the key stakeholders, so Third Avenue Radicals, the residents and business owners in that area, the service providers in that area, the Anchorage Coalition and Homelessness, and really started by doing a first round of interviews and small group meetings there. And then from that, we kind of developed a first set of ideas, and then really went back to those same groups again to work through those ideas. And then we developed a draft version of this presentation and also a report that we've shared with the Homeless Leadership Council, with the Anchorage Community or Anchorage Coalition to End Homelessness, and now here. And we've also, of course, shared that back with the stakeholders that we worked with to develop it. So right now we're really just gathering feedback on all of that, and then we will develop our final report. And that will happen within probably a month from now.
Can you enlarge the picture? It's a little difficult to read.
No, I think actually, maybe, is there a printout behind you? That might be easier. They're all
They're printing some copies of the presentation right now, and then we'll get them set out for the public. And we'll also put the presentation on the website.
So we'll making some more printouts, and it'll also be on the website. And I don't know in the slide view, I don't think I can make the text bigger, so sorry about that. So this is a little bit more detail on who we talked to. Oh, I should have mentioned also, we've been working with Mr. Ronald Evo. We've toured his site and interviewed him. And he's also been present at the last two presentations we've made. And then, of course, we sat down with Assemblymember Constant and also Zillital and Perez Villa a couple of different times, as well as the Anchorage Fire Department, the Anchorage Police Department. So we've tried to really do the rounds of the key stakeholders. We also did case study research, so we interviewed leaders from the Beacon in Houston, Texas, from Sarah's Circle in Chicago, and then The Way Home is really a multi-agency, multi-sector effort to address a sort of sector of Salt Lake City that was really the site of a lot of criminal activity. It wasn't the exact same situation we have here, but it was an area of the city that I think people felt like it kind of really gotten out of control. And so that was a effort that was led really by their police department, but it also included a lot of their providers and other stakeholders, and involved really kind of shutting down a very large shelter that was in that area, and then dispersing shelter services to different parts of the community in smaller locations. So we were interested to learn about that because it had some parallels to our situation here. And then I just mentioned a little bit about the Beacon. The Beacon's in Houston, Texas, and that's primarily a day shelter. So they have a pretty structured process where people are allowed to go in and out one time per day, and then they really just bring all of the different services into that day shelter so that people can sign up for housing, get vocational training, get all their necessary food and get a meal, do their laundry, kind of do all those things all in one place. So again, it was an interesting example to think about how could a facility like that potentially work here. Okay, I'm going to hand it back to Molly for some public safety data from the area.
So we did hear through our process anecdotally about a lot of the challenges in the area, but we really wanted to look at some of those numbers. So We were able to use public safety data from both the fire department and the police department. They track their calls in grids, and grids is divided into a series of grids, and this property, as well as Brother Francis Shelter and Beans, fall into grid 1, 2, 3, 2. So this data we're about to show is for grid 1, 2, 3, 2. So here you can see definitely an escalation of calls. That chart on the top are our fire department calls, and then the bottom are police department calls. Often both fire and police respond to a call, so we didn't want to aggregate this data. There's some overlap there between the calls. You can see the blue of the bar is Brother Francis, so those are calls that were tagged to Brother Francis Shelter. The green are Beans, and then the gray is everything else within the grid but outside of those two providers. So definitely a pretty big escalation there. I think at the highest, that high bar in 2017 for fire is over 5,400 calls that year. But we did see a little bit of a drop off in 2018. And then that 2019 was through, I want to say, September, mid-September. So that isn't a full year of data there. But definitely seems to indicate a decline, which is great.
May I please interject quickly?
Sure, Mr. Constant.
Thank you, Mr. Presbyterian. I don't see the presentation in front of me, but did you manage to produce an average call per grid for the residential parts of the municipality so people can see the scale of difference?
We did that.
Okay, so the average for the folks who are listening is roughly 50 calls per grid.
And that's the average across Anchorage. Is that annually?
Yeah, it's stunning, the difference.
Yes, so we do know this area definitely faces a magnitude larger of police and fire calls. Thank you for adding that. We also wanted to look at Anchorage relative to a couple of other communities around the country. So we used both point-in-time count data and then housing inventory count data. So this is 2018 January point-in-time count data, which is a count of those who are homeless on a single night in January. And you can see here that our numbers, we've got about 3.8 per 1,000 people. We did normalize this to a per number of people per 1,000 so we could better compare across communities. And we are lower than Portland and Long Beach, but still on the higher end of the communities we looked at. It's a little bit hard to see here with the colors, but that darker orange are sheltered homeless, so those who are in a are staying and have a place, have a bed in our community, and then the unsheltered are folks who are living out on the street or in a place not suitable for human habitation. So in January, our distribution of homeless are definitely predominantly in the shelter with a smaller amount who are unsheltered, which makes sense given the January timing of that count. We also looked at the distribution of housing solutions across the communities, so how many of their beds were dedicated toward emergency shelter versus more permanent solutions. The orange colors here on the chart show those more temporary options like shelter beds. The blue are more permanent, so permanent supportive housing and rapid rehousing. And Anchorage definitely has a higher proportion of those temporary beds. We were second of the communities we looked at, second only to Boise for the percentage of our beds that are temporary. And why this is important is that that the goal of shelter is that someone comes in and is able to either resolve or move on into a bed or another program. And if you have a lot of shelter beds but not a lot of beds for people to move on and exit out of shelter, then people can kind of get stuck in shelter. So a successful system really requires that full distribution of housing so people don't just get stuck in shelter with nowhere to go.
And actually, I have a question for you, Ms. Alto.
Thank you, Mr. Chair. So
when we compare to these other cities, did you take any kind of a look at the additional resources that may exist beyond the city, whether they were state or county? Because these places exist in a little bit different format than Anchorage.
Yeah, we didn't specifically look into funding, but we did make sure that for the continuum of care organizations we looked at, that we were including their full boundaries. So I think Denver, for example, their continuum of care actually serves 7 different counties, and so this data when we normalize by population, we use the population for that whole area, but we didn't look into the funding streams of these different organizations. We were really just looking at their housing supports and what their system looks like.
Okay.
And we also wanted to just show visually or geographically where many of these shelter beds are located. Many of them are downtown. There is definitely a higher concentration downtown, but we do have other beds located around Anchorage. The Gospel Mission on Tudor being one of them, Clare House in Spenard, Salvation Army at McKinnell House, and then also some hotel vouchers that are scattered around Anchorage.
Mr. Chair.
Yes, Ms. Constable.
Yeah, is there any way to demonstrate where the low barrier shelter beds are?
Well, of the ones that we're showing on the screen here, the ones that, well, certainly, of course, some of them serve specific populations. So Covenant House is for youth and young adults. Clare House is for women and children. Salvation Army McKinnell House, I think, is families. And then Gospel Rescue Mission does have some requirements around sobriety and participation in a church service. Partners for Progress is focused on people reentering from corrections, and then the awake beds are for people who are victims of domestic violence. So I guess those are different criteria, and for sure, Brother Francis Shelter is our single low barrier shelter, like where there really are the criteria for entry is very open.
Thank you.
And this chart here shows the total cumulative number of nights clients have stayed at Brother Francis over a 3-night period. 3-year period. And you can see the gray, about half of the folks there stay for 9 nights or fewer, so they're really moving through pretty quickly. They're not doing prolonged stays there. But we did see that just about half are staying 10 nights or more over that 3-year period. And about a third of them are actually staying more than 30 nights. And you can see there about 14% are actually staying 100 nights or more. So we can clearly see folks are kind of getting stuck in shelter and for whatever reason are not successfully moving into other programs or resolving.
Actually, I have another question for you, Ms. Alto.
Yeah, so are these duplicative individuals or just individuals, unique individuals?
Yeah, this should be non-duplicated data that we have from them. And there's a little bit more information in our report. This is one of the slides, but we have more demographic data in the full report.
So these are unique individuals over a 3-year period who, if they're counted, so if they stayed 1 night and then they came back in that 3-year period and stayed an additional 10 nights, would they then be in the 10 to 30 night number?
Yes, yeah. So it would include, so if you stay 1 night in 2017 and then 4 nights in 2018 and then 10 nights in 2019, you'd be in that 10 to 30 category. So it's cumulative nights stayed there over the period.
Okay, thank you.
Okay, so the reason that we dug deep a little bit into shelter, how it's done in other communities, and really tried to get some data and work with Brother Francis to get, kind of correct data around how our shelter at Brother Francis is being used. Is, of course, this land use plan really has to take into account, what is the value and purpose of those parcels given the current state in that area, but also what if we were to actually really address those issues, then that of course really changes the potential value and use of those parcels. So that was really the challenge of this project, is to to think about it both currently, but also with all the work that our community is really trying to do to address homelessness. As those strategies are implemented and are effective, that's going to really change the context for these parcels. So you can read our, as we go through our themes and recommendations, I hope that comes through. So when we did our stakeholder engagement, as I described, we really heard a ton of different ideas. And of course, some of them are conflicting, as always. Some people said, let's have a sanctioned camp there. Other people are like, no way can we have a sanctioned camp there. So there's lots of different things that we heard over the course of that engagement. Some of these things, though, were resounding pretty much every time we would sit down. We would hear that first off, and that top bullet is the first one. Really, we can't do any additional work in that area in terms of, if we were to add housing or do some other development there until the current situation is better under control. So that, I would say, was probably shared by almost everybody that we spoke with. Another theme is really nobody wants to see additional shelter beds in that area. So that's not really a use that I would say anybody supported. People would say things like, we don't want to double down in this area because it's already, we're not able right now to really manage it properly. So, of course, there's some discussion of, is this a good place for housing? Again, as Molly shared at the beginning, the site's not perhaps ideal for that kind of development, but it's a possibility. But more commonly what we heard was that it's not so much, and again, because we do a lot of work in this area, we know that, probably like 3 or 4 years ago, Anchorage's rental market was very tight. The market was really tight, and we, kind of worried that we didn't have any vacancy around town. Now that isn't really the case. We have much looser vacancy in our rental market. So is it really that we need to, put our resources right now into a lot of new housing? Yes, in some ways, no in others. But definitely what we heard very clearly is that when people are experiencing homelessness and accessing services in this area, they really need to be connected to the other resources that we have. So they don't necessarily need to be put into housing in this area, but they certainly do need a rapid connection into housing, which of course is what Anchored Home is about and all of our partners are working on. So another thing we heard really clearly, and this again is consistent with other work that we're doing, there's a real mix of people that are coming to access services in that area. And again, as Assemblymember Constant reminded us, this is the low barrier shelter in Anchorage. So it's really the place where you're going to get the broadest array of people coming to access services. And we certainly heard clearly that some people that are coming to Brother Francis are there for that kind of short-term stay, as you saw in the data, approximately half, where they're just needing a kind of a real transitional support. But other people have chronic health needs that are exacerbating their ability to maintain housing. And it's really important to understand that the people who are staffing Brother Francis and Beans are not clinicians. So they do have a primary care clinic there. It doesn't really have behavioral health supports right now. And so a lot of the needs that are being expressed in that area, there isn't the service to meet those needs. So again, it's that desire for better connection to the services that do exist in Anchorage that could help meet those needs, but aren't located right in that area. So I'm going to hand it over to, I have this one. Okay, so here's our potential path forward, then I will hand it over to Shannon. Okay, so again, first off, we have to improve the current situation. And some of that is, sounds simple. One of the things that was expressed really clearly is right now there isn't any way to kind of control the perimeter of the shelter and Beans site. So something as simple as a fence or some kind of containment for that area would really help both the providers and our public safety professionals really help control the boundary, control the outside area of the shelter, and also manage the rights of way. So whether that's the sidewalks or the roads, it would really help if there was some kind of physical boundary between the shelter and Beans and the right of way. that would really help get that consistent enforcement. There's been a lot of good work between the providers and our public safety officials to really make sure they're working well together. And the time when you saw in the data of the decrease in calls, that's when we had an extra effort going on to really have the mobile intervention team really present at Dean's and Brother Francis and have that really close communication. So that's clearly something that we've seen work and needs to be kept in place. And then that last one is, again, just really trying to connect people who are experiencing homelessness and trying to get services in those areas to appropriate services. And again, that's something the coalition is working on and all of our partners. So once we've kind of got the current situation under control, decentralizing shelter seems to be, the approach that's being taken by other communities. It's something we're already doing here in Anchorage, and we probably need to keep doing it. So for people who have longer-term needs, like right now at Brother Francis, there's about 10 beds for people who need medical respite. So they've come out of hospital, but they don't have a home to go to. So they're being housed at the shelter. That's a use that could be cared for in a different location. It may be other special populations like women, for example, who could perhaps be served in a different location. There's quite a few elders who are being served at Brother Francis that, again, could probably be better served elsewhere. So how could we serve some of these smaller populations who are accessing the shelter in another place to allow the beds that exist there to be turned over more quickly and then serve more people? Adding behavioral health in our community, we all know, is a huge need, and there's a lot of work going on to try and do that, but that will also help address people who have acute and chronic behavioral health needs that are trying to access services at Brother Francis, find really more appropriate clinical services. And then for our community, consistent with Anchored Home, we just need more supportive housing. So, we're really not going to address the needs of people who are long-term and harder to house without just more supportive housing in our community, which is a commitment of resources. That's really what it is. So I'm handing it to Shiona.
Thanks, Leah. Okay, great. So you heard a lot of different background and findings from the community interviews and the research. And so what does all this mean for the actual Oliva property? And so our report does recommend acquisition of the property really for two different rationales, one being a more of a short-term rationale, purchase for improved space planning, and then the other for more medium, long-term benefit in our community for navigation and public safety. And maybe I'll go through these concepts more in the next two map slides. So this map here, and you're getting the handout so you might be able to see it better, but is the short-term concept. The green area is kind of buffer space, and then the little parking spots are just areas for parking. If folks have been on the campus, you'll probably notice it's very tight. It's difficult to find parking. It's difficult to, drive up and pick somebody up and figure out, where to go. So an immediate benefit of acquisition is that you get an opportunity to create more space for the existing campus and have more parking, even have access off of Ingra into the site, and some parking at the lower part of the Oliva property off of First. We talked about keeping some of the existing buildings in place to even start some navigation, opportunities for community policing, and then again, that safer access point off of Ingra as well. The next image is more of the medium to longer term concept where you might build a community connection center, which is that blue box on the, we're calling it like the lower Oliva property. And that's where you could have a larger community policing presence, navigation, with the sort of hub model that the coalition is considering, case management, an expanded South Central clinic that would include some behavioral health, managed day shelter, and then maybe even the relocation of Beans Cafe to that location. But really the key here is what it's not. It's not additional shelter beds, it's not housing. It's really a way to sort of meaningfully connect individuals who are at the shelter to services and supports throughout our community. So I think let me go to the next slide. this slide just kind of highlights, again, we are recommending acquisition of the site as part of the broader strategy in our community. We weren't tasked from a research perspective to evaluate this purchase relative to other projects that are in the pipeline or being considered to support the homelessness system. The policymakers are really in a position to do that. But it does highlight the need for maybe a prioritization plan for Anchored Home and identifying which project makes the most sense first, second, and third. Next slide.
I've got a question for you. Are you almost finished? Do you want to wait until we're finished?
I think we just have like 2 more slides.
Okay, great.
This is just a graphic that tells you the schedule, which we're about to finish by the end of February, the report. And then, so that was it, sorry.
Great. Perfect. Well, I have a question. Mr. Dunbar.
Yeah, I guess we're going to have an opportunity to have more conversation with you after the final report comes out. Is that right? Or who does that go to?
Robin's our project manager, so that report will.
Robin here. Oh, hey, Robin.
And then our contract will be done. I think it terminates at the end of March.
So I guess I'll ask you, probably after we get the final report. Obviously, we have a long conversation with you, but I guess there are 2 main questions and sort of concerns I have with the process here and how it resulted in the recommendation. So first is the medium long term. So if we go back to slide 24, I guess it is. The medium and long term to me is compelling, but we don't have funding to do those things, right? So did you evaluate whether it would make sense to wait and do the purchase until we had funding to do those things? Because the other things you have, a buffer and parking, parking is one of these things that we have challenges with all over the community, and in the opposite way that you think of. At night, they are dangerous and empty, and so we try to not build too much parking. So that's my question. Did you evaluate whether it makes sense to do the purchase before having the medium long-term funding in place? And my second question is, given the other investment opportunities around the city, if we didn't have other political pressures to purchase this parcel, and let's say the person who was there didn't want to sell, right? Would it be something that we were actively seeking to acquire anyway? I guess that's a question for you, Robin.
Through the chairs, and thank you for the opportunity to be able to do this. I really recommend that we sit down and perhaps have a work session after the report is completed,
okay,
and identify some of those issues. It wasn't part of their scope to prioritize any of the projects that we have going forward, or to try and figure out where the funding is going to come from, or even a time frame as to when to acquire. Their job was to decide, is this something that should be acquired, and here would be the reasons, and that's really where their scope ended. So I think we could take this to the next step for us if we have maybe a work session after the report is completed, and I'll certainly work with you to do that.
Okay, thank you.
Okay. So you completed your presentation? Yes? Okay. Are there any other questions from the, yes? Oh, yes, Dean.
Thank you. I was just curious about the concept for recommended parking and adding parking. Is there some basis for the number of parking spots needed for uses here, or preferences, or so forth?
I wouldn't say it's not that specific. We were just seeing how many could fit at this point. But more detailed parking study was
Is there a number you have?
I don't know.
Sort of.
I think each of those blocks is 10. So.
Yeah, each block is 10, so.
And can I just add one thing to that? So part of that also, and I think Shannon mentioned this, is that part of what makes the current site so unsafe is that really the frontage is on to 3rd, which is a pretty busy road. And so part of what this would do would just orient everything back towards Ingra. And so, and there is a right-of-way at the north side of the property that could come through. So it would just allow, instead of everybody, kind of queuing at the front, it would allow all the traffic also to be more oriented towards the back, which would be, again, just in terms of kind of fixing immediate problems, would really help in terms of orienting people away from 3rd.
Great. And I think we have a question for Mr. Constant. I think after that, we probably need to move on to our next presentation. Mr. Constant.
Yeah, thank you. I don't know who that was just speaking, but she actually just really nailed it. I would just put a finer point on it. We have a freight mobility corridor that provides goods and services across the state of Alaska, anywhere on the road belt, and that is the highest area of incursion between human beings and automobiles. People die, people get crushed, people get hit on a daily, regularly, monthly, weekly. It's just bad. And so the short-term solution is an end unto itself rather than the mid and long-term goals, and that is to provide a safe way for human beings to coexist in that area where trucks will be traveling so people across the state can eat. So thank you, whoever that was that spoke previously, because you really hit it on the head.
Thanks, Christopher. This is Thea.
Great. Thank you for your presentation. It looks like we're done, and we're going to move on
Thank
to our
you.
next one. Thanks very much for your time and for your work. And we look forward to your final report and a work session to talk about it more in depth. Thank you. Okay, next up, we're going to have a presentation on the Anchorage Safety Patrol. Nicole, are you doing that presentation?
Yes, along with these guys.
Okay.
Do we have a different connector?
Oh, he's got a bunch of songs.
We have a variety.
Okay.
Like a real super thing. Thank
Okay,
you.
we're going to start.
Yeah, thank you so much.
Also introduce yourself before you begin.
Absolutely. So we'll just get into my second slide here. Oops. My name is Nicole Lebo. Nicole Lebo. Is this on? Hi. My name is Nicole Lebo. I am the Human Services Division Manager at the Anchorage Health Department, and I'm going to be introducing this presentation. And I have Jason Cates here. I'm so sorry. I didn't write it down, I didn't remember. But they're here from Anchorage Center Safety Patrol. And so yeah, let me just set it up.
Nicole, before you start, if I could just have each of them say their name on the record so we have it on the
Director.
recording.
I'm Jason Cates, Operations Manager of the Anchorage Safety Center and Patrol.
Great, thank you.
I'm Kai Carlson, and I'm the Site Supervisor for the Anchorage Safety Center Patrol.
Thanks for being here.
Thanks, guys. They are contract workers for the municipality, and they provide a service, and they're under the health department, and the health department just why they're connected to us. We are working for all of us all of the time. That's our mission statement at the health department, and the work that we do there, we are always following one of these essential public health services. The type of work that we're looking at today is in that assurance quadrant, where we have taken assessments about the needs in the community. We've done some policy development. We have found the money to provide this safety service. Just as some general background, we have been contracting with them since 2016. And the contracts have ranged from 1.9 to 2.1 million. And that not only covers services, but it also covers things like equipment and vans and radios and cameras that take pictures and the internet that carries all of that information around. So it's not just those services. Let's see, and it's a pretty complex contract. The first one was over 81 pages, and so it has lots of procedures associated with that. Primarily, they provide services for the Safety Center and Safety Patrol, and you'll learn more specifically what that is. I'll let them speak to their own services, but their contract also provides for possibilities for warming stations and emergency shelters. So that's where you see that it's an accordion of a budget. And we are governed by state and municipal code, and most notably Title 47. Title 47 is a big title. It covers lots of vulnerable populations as well as multiple types of providers. And so those types of providers could be anywhere from a crisis center or a hospital, detox center, healthcare providers, and it also covers the work that these guys are doing because it is taking vulnerable individuals into protective custody. So that's the similarity between all those types of providers. Unfortunately, Director Pinea is not here. Her son had to go home sick for the day, so she's doing that instead. But we are just requesting that if there are any serious policy or budget or contract questions, that you direct those questions to her, and then she'll work with her team, myself, we have a program manager, and then with Jason to provide those answers. So now I'll let these guys do their thing.
All right, again, thank you. I'm going to have Kai start this.
So the Anchorage Safety Patrol and Safety Center is a BLS ambulance service accredited by the state. We have multiple vans that we use to transport clients that we find in the field to our safety center. Our safety center is a municipal protected custody facility located adjacent to the Anchorage Jail. We are open 24/7, 365, shut off the lights. And what we do is we monitor the clients as they go through the sobering process to make sure that they are safe and healthy. We provide, as you can see, safe transport to the safety center, shelter and ongoing monitoring, basic wound care, and when available or necessary, we provide donated clothing to the clients. These are just some pictures of basic wound care we provided. These are wounds that have been treated previously but had gone untreated for an extended period of time, and we felt that it was our duty to go ahead and treat these individuals. We also operate as a gateway to access additional services such as rural CAP coordination, homeless resource coordination, and veteran services for our clients. So our staffing, we have our operations manager, Jason Cates, myself as the site supervisor. We also have Mr. Brian Steves as our health and safety officer. The station shifts consist of 1 EMT and 2 support staff. Those shifts are from 8 in the morning to 4 in the afternoon, 4 in the afternoon to midnight, and midnight to 8 in the morning. And when necessary to maintain our ratio, we will call in additional staffing if need be. Our staff come from many, many different walks of life. Myself, I spent 6 years in the Army as a combat medic. Mr. Cates has over 15 years in the fire service. We have people who come from all kinds of different walks of life, and they contribute to providing a necessary resource for our clients, and they contribute to an very interesting workplace. One of the things that we are very big on at the Anchorage Safety Center is continuing training. A lot of the skills that we do use are perishable. If you don't continue to practice them, you will lose them. We strive to provide the best care medically that we can to every single client that we deal with. And a big part of that is ongoing training. We're always training the Safety Center. We're always learning something new every single day. So we operate under standing orders from Dr. Michael Levy, who also is the medical provider for AFD. What standing orders allow is for us to treat certain conditions that we would normally have to contact our medical provider to treat. It saves time in the treatment process. It prevents having to make unnecessary phone calls for things that we need to treat immediately. It saves a lot of time in the background when we need to treat an emergent patient. So Title 47 protected custody, we are allowed to hold our clients for up to 12 hours. After 12 hours, we have to send them to a hospital if they're still considered Title 47, they're still unable to take care of themselves. Generally, that is going to be because there are other background issues that we cannot treat. Most of our clients are not going to be staying for 12 hours. They're going to be good to go anywhere between the 8 to 10 hour range. Our facility has a capacity for 50 individuals, and we maintain a ratio of 10 to 1. So that's what I was talking about earlier, with we bring in other staff if need be. Once we start to get to the 30-ish range, call in other additional staff to maintain that client ratio of 10 to 1. Most of our clients are very substance dependent. That's where that 12 hours comes in. They're going to need to get out and take care of themselves and their needs long before they reach that 12-hour mark. A lot of them are also have untreated or undiagnosed mental health issues, which makes our job very interesting. The purpose of Title 47 is to prevent people who are trying to self-medicate being criminalized. There are people that need treatment, they don't need to be in jail. That's what we exist for. This slide explains what an intoxicated person is. An intoxicated person is a person whose mental or physical functioning is substantially impaired as a result of use of alcohol or drugs. So it's not illegal to be drunk. It's not illegal to be drunk in public. The problem comes in when you are too drunk to take care of yourself and to make choices that are beneficial to your life.
Is there a level of intoxication that you require in order to be served?
There's no level of intoxication that we require. If you are intoxicated and you are unable to make the correct choices for yourself, we step in. If you cannot properly shelter yourself, you can't properly handle your bodily needs, that's where Title 47 comes in.
We have a flow chart coming up here.
This covers another section of Title 47. So we do not only people who are just drunk, we do deal with people who are on a myriad of different drugs. After they've been cleared by the hospital, they will come in, they'll sober up in our facility. These are some signs, some common behaviors we'll see with people who are severely inebriated: noticeable clumsiness, impairment to their peripheral vision, decreased reaction time and motor performance, staggering, slurred speech, blurred vision, loss of judgment, impaired intellectual functioning. You'll see a lot of these with people who are severely intoxicated. This is the flow chart that we were talking about earlier. So in a typical call, we will arrive on the scene and we will immediately begin our assessment. And it's a cumulative assessment. The more things that we tick off going, okay, this person may be Title 47, this person may need help, it creates a mounting suspicion, and that's what we use to determine whether we're going to take them to the Safety Center whether they need to go to a hospital to receive further care, or whether this individual does need to go to jail.
And just to stop there for one moment, wrong way. Just the two on the outside, the client is combative or the client is unstable, that is when we are bringing APD or AFD to support the processes that they're going through and the assessment. Otherwise, and as it relates to the budget that we were talking about earlier, some of these services defer the costs that would otherwise be spent by AFD and APD. So it's just a good reminder and context that sometimes they come back and they end up supporting these services regardless.
This slide is a bit more of a breakdown on an explanation on that previous slide. So we do use a field breathalyzer. That number is important only as far as a diagnostic criteria. It tells us whether someone is actually consuming alcohol, whether they are becoming more or less inebriated. It is not the end-all determining factor in whether someone is Title 47 or not. The next step in your assessment, in our assessment, is going to be whether they are alert to person, place, time, and event. Do they know who they are, where they are, what is happening around them, and roughly what time of day it is? Then we're going to go next to checking their speech. Are they coherent? Are they having the same conversation you're having with them? Or is their speech slurred? Is there a reason for their speech to be slurred? After checking their speech, we will test their gait. Gait is a very good determiner whether someone is inebriated or not. Of course, we do deal with individuals who are unable to walk or who have disabilities that prevent them from having a normal gait, and that is taken into consideration when we are assessing our clients in the field. And these next two are determining factors for whether they can come with us or if they need to go with another agency. If the client is being combative, we are healthcare providers first and foremost. We are not out there to injure people, and we are not out there to be injured ourselves. If they're combative, they're actively fighting us, they're actively resisting, have a weapon, or suspect of having a weapon, we will contact APD. We will go to our vehicle and we will wait till the police arrive to handle that situation. If the client is medically unstable, too medically unstable for us to handle, then we will treat them in location and wait until AFD arrives to take them to higher care.
And so just to add specific, Cameron, to what you were asking about the breathalyzer, just based off of what we know about people who suffer from substance abuse disorders, some people are able to have a breathalyzer that, like, the number is way high and they're still functioning. And so, right, like that number doesn't mean the same thing for every single person. And so that can't be the only qualification. That's why they have all of these overlaid on top of each other. You feel fully like we answered. Okay.
It's a diagnostic tool.
Yes. Thanks. You got it?
Okay, so we've got some numbers here for y'all. So these are 2019 numbers, intakes for the safety center. Total intakes 13,332. That's how many people we inputted into our system at the safety center. So to give you some other numbers here, we were dispatched to 21,000 calls last year throughout the Anchorage community. We've got a map here to show our service area. That's a lot of calls that we take off of the other agencies, from the fire department to the police department.
Actually, before you go on, I want to ask the same question that Ms. Alto asked. Are there any duplication of these numbers, or are these numbers all unique individuals?
So yes, they are duplicate. So you can have somebody that comes in X number of times in a month, where other people come in once. So.
Or on a singular day.
Yeah. Something else that's really good about this slide is the walk-ins. So we had almost 1,300 walk-ins last year. That's people that would walk in to the safety center. So we ran some numbers. 2017 it was 605. So the folks that we deal with, the clients that we deal with, understand it is a safe place and they can come there for help. So that's a good thing, seeing those numbers go up.
Is it possible to get unduplicated numbers so you have a sense of actually how many individuals you're serving, and then those individuals, how often you're serving those folks?
I can send our most recent report for our singular month. I don't know that we have it unduplicated for all of 2019 yet. I think they're still crunching the numbers. But for last month, I feel like they were maybe like 1,000 intakes to 400 individuals. Is that right? You can send it.
Okay. So let's see here. Actually, this was January. To give you a ballpark, though, we responded to 1,400 calls in January, roughly 1,400 calls, and then the intakes were 912. So not every call generates an intake because not everybody we deal with is Title 47. But as far as single,
it's 394 individuals made up those intakes.
Okay.
So
you repeat customers.
Yeah, we know these folks by name. So this graph here is a little bit hard to see with the light, isn't it? But it shows the time of day, how busy we are, our call volumes. So you can see that, around noon it's starting to pick up, and then it starts to die back off by 11 o'clock, 12 o'clock. So that mid-range is when we're really busy, and we have 2 to 3 vans on the road at that time.
How many vans do you have total?
So we have 5 total.
Mr. Chair.
Yes, Mr. Constant.
Thank you. I hear oftentimes you have a limited service area, but I was actually driving down at Diamond and Old Seward recently and saw one of the vans operating, and it raised the question, because some people think maybe we need to invest more to expand your service area. Do you think it's reasonable, or maybe you can tell us your policy on the service area and then how we might better serve Anchorage?
I would say that's, Mr. Constance, this is Nicole Lebo. That's an ongoing conversation that we're having and trying to really crunch the data. They do have a specified service area, and just FYI, their van service area is right down there by Diamond. So it sounds like you're saying that they were actually picking up someone. I don't know exactly what situation you're referring to, but we are in the process right now, so we don't want to describe like what that's all about, but we will be making recommendations for possibly changing the contract to look at, we're just looking at the data. We're looking at it as a municipality, you guys are looking at your data, and we're going to come together on what that would look like in the future.
So who at the municipality is looking at that?
AFD, APD, and the health department.
All right, thank you.
Yeah, you got it.
Mr. Gates, do you have a question as well?
Thank you. I want to ask about staffing for the safety patrol. I saw your other slide earlier about staffing. I assume it's just for the safety sector, the operations manager, site supervisor, EMT, chief support staff. That's just the safety sector, is that right?
Correct.
So
And we'll get into the van.
patrols.
So on the vans, we actually have a EMT and a driver. Now the driver is not an EMT, but they are CPR first aid trained.
And are the 5 vans in constant operation?
No, I'll have a graph that shows you a breakdown of their time frame.
Okay, sorry to get ahead of that.
And I have actually one more question for you, Ms. Davis.
Thank you, Mr. Chair. So how was this area set up? Was it based on calls and where we see people who need those services, or how have you established this?
Right from the get-go, we were working with all of the data that we had in the municipality. We considered Government Hill, we considered lots of different things, but this was the concentration of most of the calls that could be serviced at the level of care that these guys are trained for and certified to deliver, using their standing orders without having to call in other higher level of care services. And so you can also see that there's a pink and a purple. Can you tell the difference from? Okay. there's one where they're constantly patrolling, and then there's other ones where they can get dispatched, and that dispatch number comes straight through AFD, right?
Yep.
Call the number, and then they call us rather than sending fire if they're in this boundary. And so that's why now looking at data of different calls in different areas that police and fire are responding to, that's why we're in the moment of discussion of saying, is it worthwhile? Well, how much does it cost you guys? How much would it cost you guys? I mean, and it's going to be like an easy game on Monopoly from there, right? Like we have to figure out where is the need and how much does it cost to provide that service.
Great, thank you.
Yeah, you got
And
it.
for the record, we've been joined by Mr. Weddleton and Mr. Gates. You have a question.
Yes, I want to follow Ms. Kunditz's question about the service area. For some historical reference, I've worked at the municipality a long time. This has been the size of the service area first on the second here was established 2000 something or
Their contract started in 2016.
So the service area was already established.
It was already established? Okay.
Didn't we have safety patrol before it was a contract with Securitas, just provided by some other entity or provider?
I can't speak to that right now, but I can get you the answer to that following this meeting.
Sure.
Yeah.
I think this goes way back.
Yeah, I know.
Mr. Chair.
Yes, Mr. Cox.
Previously, the Downtown Partnership held the contract for a number of years under Becky Beck's leadership, and after that, it was another security firm. So it has been in operation since at least 2000 and something, 2002 maybe.
Thanks. And just a small note on time, we probably got about 5
Okay,
minutes.
we'll breeze through here. This is Midtown. It's been kind of a hot topic lately, so we had AFD pull some numbers for us. Midtown accounts for almost 25% of our call volume of that area. So in 2019, we had a little over 5,000 calls to that grid right there. So that's a hot spot. This is from Chief Tyra. You'll see in your handout. I won't go through that, but he's a dispatch battalion chief. He's in charge of dispatch over there. So we have a great working relationship. Here's some photos of us working with our partners, AFD, APD, other agencies, Beans Cafe, security. So here's some of the things we deal with on a day-to-day basis. Drugs, terrible. Reaching pockets, trying to do searches. You got unsecured needles. The middle picture there, Brian behind me retrieved a firearm from an individual. So it happens. We deal with bad things on the street. You can see the knives, brass knuckles, and we have no protection. So again, that's why we call APD for help quite a bit. If somebody's very combative, that's not our job. So things that's challenging for us, the clients that we deal with, a lot of them are abusive to us until they sober up, and then they're usually nice, but we're usually, quite frankly, cussed out every day. But it happens. We deal with the bloodborne pathogens on a day-to-day basis, the odors, the smells, the things that normal society doesn't have to deal with, and we're dealing with right in our face. So again, talks about the history of being unsafe, the different areas. We've talked about that. You all touched on it on the last PowerPoint. Big one for us, staff continually sick. We deal with the chronically ill. They're in our face every day. We're in their face, so we are chronically sick all the time. There's some more challenging situations. The bottom one there on the left, that was taken right off of Facebook, so people take pictures of us all the time. We're in public's eye. We have a deceased person there. We have a mentally ill person where we've had to call the police to help us with that. Approximately 30 of our clients that we knew, well known by name, have died in 2019. That's tough on our staff. It really is.
Yes.
Can you tell us more about is that like you found them dead on the street? Or
not all of those, but some of those.
And they died.
as a whole, they have died. They've been hit by cars, they've just cardiac arrest, they've frozen to death. We see a lot of it, we don't see all of it, but it's tough on us. It really is to deal with that day in, day out. Here's some of the volunteer work that our staff does. Great. Here's Kai performing a wedding ceremony for 2 of our clients. So, we do a lot of other things than just pick up the inebriates. And here's some of our team building things. Just like everybody else, we like to get out and enjoy Alaska.
We've peppered the questions throughout, but does anyone have any remaining
You do.
questions?
I have someone up Ms. Dunbar.
Thank you, Mr. Chair. So it relates very much to the last part of your presentation, but I was thinking about it from the very beginning. So it's about a $2 million contract, that's right. So it's not a huge amount of money. What is your staff turnover like? And it seems like you've got some really, my girlfriend, for example, is an ICU nurse. I mean, it seems like your staff have skills that other employers really want. So are your wage rates competitive?
Yes, as far as EMTs, we get paid pretty well for what we do. We do have high turnover. In the last 3 years, the other agencies that we've been talking about have noticed the change in our staff, and they have been recruiting our staff. So we have folks going to the airport police, the fire department, regular APD. So we do have a lot of turnover. And some folks, it's not for them. This is a tough job. This is an in-your-face job. It's really, really challenging sometimes.
So if I understand what you're saying is, well, first of all, is the turnover hampering your ability to function well? And second, I mean, are you recognizing that other agencies are headhunting essentially from you? Have you been able to increase wages under the contract we've given you?
No.
And the first part of my question, has it hampered your ability to function?
No, we hold our own. It may be where I jump on a van or Kai jumps on a van or Brian, and to fill those slots, but we make it work.
Jason, I would say, is incapable of answering in any other way, but I do think it makes it a lot harder for them, and they are constantly doing extra work that would not be necessary if the turnover wasn't there. And I also just want to congratulate Jason for the improvements that he's made over the last couple of years to be something that I was like, you guys get the presentation. I'm not, you talk about you. You're amazing. And he has brought a stack of cards. If you want to just introduce that topic and like what your invitation is.
So I did bring some cards. It's call for service cards. We had them printed up a couple years ago. We hand them out to the businesses because a lot of times people don't know what to do with the folks that are laying on the corner, right? So we need to get some better public awareness there. So I do have those cards. And then you'll have an open invitation to come down to the center, do a tour, do a ride along. We're always proud to show off what we do.
That's great. I have one more question for you, and then we need to move on. But Ms. Alton.
Thank you. It's not really a question so much as a comment. Is that these guys are extremely humble in the work that they do. When I went on my ride along, I was impressed not only with the dignity and respect that they treated everyone they encountered, and just that people trusted them. I mean, the service is truly invaluable, and I really appreciate you guys for the work you do. So thank you for coming and taking your time away today to talk with us, and I really would encourage folks to do a ride along. It's an eye-opening experience. So thank you.
Thanks very much for being here.
Thank you all.
Appreciate your presentation. Okay, we're going to move into our next item, committee discussion. Is there any discussion the committee wants to engage in at this point? All right, seeing none, we're going to move on to the next part, which is audience participation. And actually, the microphone is right there. And we'll just first come, first serve. You'll have 3 minutes to speak. Who would like to begin? Mr. Leva. The mic's right there.
Oh, that's all right. I'm an auctioneer. I can speak loud. Us 5 kids. Who whispers? I'm here to answer any questions about the Agnew-Beck study, and then, do you have any in that relationship?
I do.
Okay, sure.
So, Mr. Aleva, the property is actually 3 parcels.
Correct.
Do we have the opportunity to purchase just one of the parcels, the one adjacent without the other 2?
Well, they all go together, basically, and because I want out, the best way to sell them is all 3 together.
Okay. So you're not willing to sell us just one, but there's one that's immediately adjacent that would resolve the right-of-way concerns, but the other 2 that are on the other side are less directly related to the campus?
Correct, but I think what you should look at is, as I suggested, the Catholic Charities of Southern Nevada, that this is an opportunity to expand, even with sunset laws, the services that are provided. And the immediate one, whether it's a sanction to camp or not, would alleviate the campsites across the city and allow them to go there with proper monitoring. That's real important. And then the phase out of job training, whether you had a bicycle repair shop or followed Habitat for Humanity in a sales yard and started getting those people jobs and training, detailing cars, working at a car wash, or even splitting wood, but you would get donors to go down there. And with the right plan, this would be self-sustaining with income flow. Kind of like the Salvation Army with their work program and Habitat and community service workers. I think this is, they're there now, and any other location you try, you're going to hit a wall that is a lot of wasted time, because they're there and they surround my parcel. And I can tell you that if you don't buy it or someone doesn't buy it and I sell it to someone else, you've missed an opportunity. So,
I have another question for you,
Mr. Chair?
Yeah, you'll come up next, Ms. Constant.
Mr. Levi, I was just wondering if you had any thoughts after watching that presentation, or things that you wanted to reflect to us that weren't represented in the presentation about your property, or about just anything we don't know or wasn't there.
well, I think if anyone has been affected by that location, it's been me personally and then the business. And you wouldn't believe that in 2012 there was 800 calls, but in 2017 there was over 8,000 calls, and those are responsive. And if you follow this graph on the number of calls, you can follow my economic losses increase proportionately to the number of calls. Plus, you could track my personal health. Physically, mentally, and spiritually has gone proportionally to this. So it's time for me to get out, and it's an opportune time for the city or the nonprofits, if they really want to develop programs that will solve and at least work on solutions to the homeless problem. That's the location. They're there already, and I don't think any other place in the city offers this opportunity.
I have one more question for you, just Mr. Constant. We're running a little short on time, so I want to make sure that we're getting to everybody else. But Mr. Constant, do you have a question?
Yeah, thank you. Noting that there are some members who will work really hard to find any excuse not to buy these properties from you. Ron, are there any other private property owners on that overall block around you there surrounding the shelter?
No, I'm the last remaining one, and that, if the city bought it, ML&P would be the only other person on the block. So it's all city property. So by acquisition,
all institutional.
It's
yeah.
all institutional.
Okay. Thanks, Mr. Lee. I appreciate your coming forward and speaking. Do we have anybody else who would like to speak today? Yes. And if you would use the microphone that's over on your right there. Sure. It helps with making sure that your voice is in the record.
My name is Linda Chase, and I just want to say that Ron Oliva is one of those people in our community that is most generous, kind, and thoughtful. And he has been dealt a really difficult hand. And because of who he is it's not fair. We should not be treating any of our citizens like Ron has been treated. And that property needs to be bought by the municipality or some partners or something. The plan looked reasonable, but we need to be better to some of the people that really do wonderful things in our community. And Ron Oliva is one of those. Talk to any of the neighbors where he lives. Gretchen Cuddy, David, whatever. And we have not treated him fairly. And it's very disconcerting to anyone who knows about this. Thank you.
Thank you. Thank you for your testimony. We appreciate it. Would anybody else like to speak before we move on to the next item? Okay, seeing none, we're going to move into committee legislative and budget priorities. Who is leading that part of it?
I can.
Yeah.
So we were asked to put these on our agenda as standing items, and this is the first month we've put them on. There's nothing specific other than right now we aren't joined by the coalition today because they're actually in Juneau advocating, so that's good news. And it's to budget items for 2021. If you have specific ideas, I know we left some areas around homelessness, particularly around day shelter, kind of for first quarter budget revisions. If you have ideas or thoughts about that, we're working with the administration. Jason is kind of the funnel to start, and then he'll push it out from there. And then we can then maybe have a more robust conversation about that in March. So on our meeting of 3/18. So that's it.
Okay. Any other things on legislative priorities or budget items? Seeing none, that looks like it completes our agenda for today. I really appreciate everyone being here. And with that, I will adjourn the meeting. Have a great day.